Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
All right, let's talk about changes and kind of updates in cardiovascular management for non-cardiovascular surgery. Now, recommendations are getting a Duke Activity Status Index to DASI. Doesn't that sound good? And if it's greater than 34, you can proceed with surgery without further testing. What else can you use? Metabolic equivalence, greater than 4. What's that's the METs. So what's greater than 4? Hey, can you walk up a flight of stairs without going short of breath? That's a good way to check in somebody. Can they go up a flight of stairs? Now, sometimes people don't have a flight of stairs to go up. Now, if poor unknown functional capacity, it may be reasonable to get a BNP, pro-BNP, or troponin, or all two of the aboves, BNP and pro-BNP, about the same. Very weak evidence. If elevated, what do you do? Well, they say get a multidisciplinary team discussion. That's a way of slowing and delaying surgery and getting more people involved in lawsuits. Now, stress tests. Stress tests used to be involved, but use this for elevated risk, poor or unknown cardiac function, if high-risk myocardial ischemia. Preoperative stress testing and revascularization have not shown to improve outcomes in patients. But the patients with high-risk coronary anatomy were excluded from the research. So these are things to think about. Now, they do want you to stop your SGLT2 inhibitors, the sodium glucose cotransporter 2 inhibitors, 3 to 4 days prior to minimize a risk for ketoacidosis. And it is reasonable to follow troponins for someone who has a myocardial injury after non-cardiac surgery, MINS.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.